Hello, my name is Lee Trevino and I'm with Xoriant, and I will be going over your benefit options for open enrollment effective January 1st, 2018 for Xoriant employees. I will be going over what is open enrollment, plan year and eligibility, your new PPO medical options through United Healthcare, the Kaiser medical only options, United Healthcare dental, VFN, Anthem Life and AD&D, P Vision, military insurance, flex spending FSA benefits, and then your services contacts. So what is open enrollment? Open enrollment is the ability to change your medical carriers. So if you were on Anthem previously and you were considering Kaiser or vice versa, you previous United Healthcare option to consider. Now is the time to make those changes. Whatever you elect will be changed effective January 1st, 2018, as well as dependents. So if you previously waived coverage and now you're considering enrolling, or if you waived coverage for your dependents and you're considering adding dependents, now is also the time to do that. Also a good time to update your life insurance beneficiary. If no changes are made, you must wait until open enrollment to make changes unless you have a qualifying event. So whatever you elect, the plan selections, your dependent status, you are locked in for the year unless you have a qualifying event. So the only changes you could make for a qualifying event is adding dependents. And so a qualifying event means that you got married, divorced, you had a child, or removing, adopted a child. You are a dependent that reaches the age of 26 and no longer eligible for your parents' coverage, or you are your dependent coverage through another group plan, like from your spouse. So if dependents lose coverage to a spouse and they've lost that coverage, they have 30 days to plan. You must notify HR within 30 days. If you do not notify HR within 30 days, you will have to wait until open enrollment next year, which would be for an effective date of January 1st, 2019. So again, it's really important that you notify HR of any changes to your dependent status. So the plan year runs from January 1st, 2018 through December 31st, 2018, and the open enrollment period will be from December 4th through December 15th, and you will receive an open enrollment email with instructions on how to log in and coverage for the January 1st, 2018 plan year. All employees must elect coverage or they will be dropped from coverage for 2018. And your next opportunity to enroll will be January 1st, 2019, unless you experience a qualifying event. So again, it's very important. You do have to go into PlanSource to elect coverage. If you do not elect coverage, you will be removed. So if you were somebody who was previously enrolled, your new plan year will not be automatically enrolled. You have to go in and elect your new coverage for the new plan year. So your first PPO option is with United Healthcare. So United Healthcare is a new carrier this year, but have Anthem after January 1st. So it's real important to make sure that if you have any doctors that you're currently seeing, any medications, you want to check to make sure that your providers are contracted with United Healthcare. If they are not contracted with United Healthcare, you will be out of network. So please, they are contracted. So you always want to stay in network. If you're going out of network, you're going to pay more money out of pocket. So you'll see that the in network for 100, but you'll see out of network. Family, it's 1,000 in network. For family, out of network is 2,000. And so if you ask a doctor's office, do they take United Healthcare, they will all tell you yes. You want to make sure that they're contracted, because if not, you're going to be out of network and you're going to feel like you're paying a lot of money out of pocket and you will feel like you don't have good coverage. So you'll see the deductible is your responsibility is that first 500. So before United Healthcare will pay for hospital or surgeries, you're going to be responsible for that deductible. Once you hit the deductible, then the insurance company will start to pay for your covered services. Your individual out-of-pocket maximum is $3,500 for individual, $7,000 for family in network, And your out-of-pocket maximum means that is your worst case scenario. So for example, if you had a bill that was $1 million, the most your is $3,500 if you're single or family. After healthcare will pay for all covered services at 100% for the rest of the year. So that United deductible and out-of-pocket maximum are calendar year. And then your office visit copay is a $20 copay. In-network is covered at 100%. Out-of-network is not covered. Hospitalization, so if you had to be hospitalized or if you had to have a surgery, again, you're responsible for the bill of $500 or $1,000 for family, and then you'll pay 20% up to the maximum deductible of $3,500 if you're single or $7,000 if you have a family. After that, United Healthcare will pay the rest of the bill at 100%. Your diagnostic lab and x-ray is covered at 100%. Emergency room copay is a $100 copay. And then mental health and chemical dependency are covered as any illness. So inpatient, hospital, and the office visit copay for outpatient. Prescription drugs are $10 for generic, preferred brand is $25, and then the non-preferred is a $50 copay. Your next option is the United Healthcare PO 5900 plan. This is a high deductible plan. So this plan, PPO is, you'll see, is more inexpensive as far as cost. And the reason is that it's a major medical plan. So this plan is a benefit if you're somebody who's pretty healthy, doesn't go to the doctor frequently, and you're comfortable with a higher deductible. So the deductible in this plan for individuals is $5,900, and then for family it's $11,800. You'll see out-of-network it doubles. The out-of-pocket maximum for this plan for individual is $6,350, and then for family is $12,700. The office visit copay, so this plan you get 3 visits at a $35 copay. If you exhaust the 3 visits, then you're subject to that $5,900 deductible. So once you hit 3 visits, you're going to be responsible for the full cost of the office visits at the discount. And then once you hit the deductible, then you'll see that your hospital, surgery, diagnostic lab, and x-ray, they're all covered at 100% after the deductible. Your preventative services are also covered at 100% in network, but it's not covered out of network. So you'll see that out of network, it says services are paid at 50% after deductible, but again, there is no discount, so you'll pay more than 50% after that $11,800. So you want to make sure that you're staying in network and you'll feel like you don't have any coverage. And then emergency room ambulance are also covered at 100% after the deductible, as well as mental health and chemical dependency. The prescription drugs has a brand name deductible, $100 for single, $300 for family, and then generic is a $10. Preferred brand is a $30 copay after deductible, and then the non-preferred is $50 copay after deductible. So online tools for United Healthcare members. So there is information on your benefits and coverage. If once you are with United Healthcare, you will have access to benefit information. You can find a doctor in network. You can manage your claims, manage prescriptions, track your medical expenses, conveniently access your ID card. And so once you receive your ID card from United Healthcare, which will have your registration information, you can go to the myuhc.com website and have full access to your United Healthcare benefits. So real importantly, just want to also remind you, so United Healthcare is going to be a new care effective January 1st. So you will have new ID cards. You'll need to make sure that you give your providers, pharmacy, your new ID cards once you get them. We have had situations where people forget to give the pharmacy their new ID card and the old insurance, and it's canceled. So you want to make sure that when you go to the pharmacy, you give them your current United Healthcare ID. That way they can run it through your actual active coverage. And so you'll want to be on the lookout in the mail in the next few weeks for your new ID cards once you go on and elect your benefits. So again, very important, make sure that you find a doctor that's contracted, give them your new ID card as well as the pharmacy. And then you have a Kaiser option. This is available in California only. Kaiser is an HMO, so they are not out of state. They are available in different states. However, usually if you are contract, you can only access on a temporary visitor. So like if you were in Oregon, you can access the Kaiser facility, but only as a visitor. So ideally, anybody that lives outside of California would not want to be on Kaiser because the only way to access care would be if it were a life-threatening emergency. California, you need to go to Kaiser campuses. It is HMO, so you don't have the ability to go out of network like on a PPO. And so with this plan, there is no deductible. The out-of-pocket maximum, again, that worst-case scenario, you have that $1 million bills, individuals $2,000, families $4,000. The office visit is a $30 copay. Specialist is a $30 copay. Preventative services are covered at 100%. Hospitalization is a $250 admit copay. Outpatient surgery is a $100 copay. Diagnostic lab and x-ray is a $10 copay. Advanced imaging is a $50 copay. Emergency room is a $100 copay. And then mental health and chemical dependency is covered as any illness, so hospital and office visit copays apply. And then prescriptions are $15 copay for generic and then $30 for preferred brand, and then there is no deductible. Kaiser also has a really great website. You have online tools for Kaiser members. You can go to the kp.org website. You can register. You can email your doctor. Definitely save some time. It's really nice and convenient that you can also go in and view your lab results. You can print immunization records for your kids. You can save time and money by not having to take time. And you can actually schedule phone appointments with your doctors or just email them general questions, and then not have to go in and pay your office visit copays. And there are also Live Healthy online tools, wellness coaching and classes, and then online health assessment. Your new dental carrier for Xoriant employees effective January 1st is with United Healthcare. So this will be replacing Anthem. And so if you have not used your Anthem benefits, I encourage you to use them at the end of this year because you'll have a new maximum effective January 1st with United. And that is a $1,500 annual maximum per person. And the deductible is $50 for individual, $150 for family. So what that means is you wouldn't pay more than deductibles. And so if you have a family of 5, you're just going to pay the 3 deductibles. But it is way for preventative, so when you're getting your cleanings, x-rays, covered at 100%. So just like medical, if you're going out of network, you're going to pay more money. So although it says 100% out of network, there is excess charges because there's no discounts. They're not contracted with United Healthcare, so you'll end up paying more money out of pocket. And so to get the best coverage for your dollars, you'll want to see a contracted United Healthcare. And then base services, so those are like your fillings, root canals, deep gum cleaning are covered at 80%. Major crowns, bridges, inlays are covered at 50%. And it is an annual maximum of $1,500 per person per year. So however many members in your family, each person gets $1,500. It runs from January to December. And then for orthodontia, there is orthodontia services, which is 50%. And so it's for child only up to the age of 19. And it is a lifetime maximum per child. So what that means is that you only get $1,500 one time. It's not like the annual maximum benefit per person. This is just the lifetime maximum. And then out-of-network claims are paid, reimbursed at 90th percentile UCR. So what that means is if you have sometimes there are dentists that don't contract with any carrier, or if you have a favorite dentist and you don't want to change and they're not contracted with United Healthcare, you can still go to those dentists. This plan does still pay very well. They will pay based on what 90% of the dentist surgery area would usually charge. So they will pay well out of network, but again, to get the best coverage for your dollars, you would want to go to United Healthcare geographical contracted provider. So for vision, there's no change to your vision carrier. You still have VSP. They have one of the largest networks in the market. And so this is also a PPO. So again, if you go in network, you're going to get better coverage. The frequency is you get one exam every 12 months, one set of lenses every 12 months, and then one set of frames every 24 months. If you go out of network, you will have to pay out of pocket your receipts to VSP and then get reimbursed up to the allowed amount. So you'll see submit for an exam, they're only going to reimburse you up to $50. But if you go in network, you just pay a $20 copay and the rest of the exam is paid in full. Materials for lenses or frames, you do have a $20 copay. So for lenses, those are covered in full. And then frames, you have a $130 retail allowance and then 20% discount off the balance. So how that works is if you were to get some frames, they cost $200. VSP will pay $100, and then you'll get 20% off the remaining $70. You can also this, but it's in lieu of glasses, so you get one or the other. You wouldn't be able to get both. You also have Sun Life Voluntary and AD&D. So this allows you to purchase more life insurance at your cost. This is not paid for by Xoriant. This would be at your cost. It's very affordable and it's guarantee issue for employees as well as spouse. And so you can purchase in units of 10,000 up to 150,000 for you, and it's guarantee issue up to 150. You can also purchase coverage for your spouse, and that is in units of 5,000 up to 250,000, and the guarantee 50,000. And then for your children, it's 1,000, 5,000, or 10,000. And the coverage is portable. So if you ever left the company, you would be able to continue this life insurance at your cost, and so you can take it with you. The spouse amount cannot exceed 50% of your election. So what that means is if you decided you wanted to purchase $100,000 life insurance for yourself, you cannot purchase more than $50,000 for your spouse. Sun Life Voluntary Accident, this is issues for off-the-job accidents. It includes benefit for hospitalization, fractures and dislocations, emergency room visits, and more. No health questions or pre-existing conditions limitations. It pays benefits directly to you to use in any way you choose and in addition to any other coverage you may have. Coverage is portable, and so it's covered accident. Again, if you can take the benefit with you. And then it does have a $50 wellness benefit. It left the company each year. So what that means is if you were to go in and get your annual checkup, you would submit the claim, and then Sun Life will send you a check for $50 for getting your annual checkup. You also have Sun Life Voluntary Short and Long-Term Disability. So in the event that you become disabled from a non-work-related sickness, disability income benefits will provide a partial replacement of lost income. And so short-term disability provides a coverage to replace your income if you're unable to work due to sickness or accident, the injury. This policy provides employees with 60% of their weekly income, up to $1,000 a week. The long-term disability provides coverage to replace your income if you're unable to work due to a sickness, illness, or accident. This policy provides employees with a 60% of their monthly income, up to $5,000 a month. You also have Sun Life Voluntary Critical Illness. So this is a benefit that would cover illnesses such as heart attack, heart failure, stroke, coronary bypass surgery, end-stage kidney disease, occupational HIV, hepatitis B, C, or D, major organ failure, advanced Alzheimer's, Parkinson's, or cancer. You also have the ability to enroll on the flexible spending account. This is a healthcare FSA. This is through the Advantage Group. And so the healthcare FSAs allow you to contribute pre-tax dollars to pay for qualified medical expenses. The maximum amount you may contribute for 2018, it increased this year by $50, so it's now $2,650. You also have the ability to elect Dependent Care FSA, which allows you to contribute pre-tax dollars to qualified dependent care. The maximum amount you may contribute each year is $5,000 or $2,500 if married, filing separately. So the way the flexible spending account works is that you can elect to set aside pre-tax dollars to help pay for healthcare expenses. The minimum that you can elect annually is $100. The annual maximum is $2,650. So you want to be conservative in the amount that you elect. So let's say that you're going to have a surgery, or you know you're going to have some dental work done, and you decide that you want to elect $1,000. If you do not use that whole $1,000, $500 can be carried over to the next year. Some people choose to just do the $500 just to be on the safe side. We'll have some funds set aside to help pay for healthcare expenses, and then that way, if you don't use just to be able to, it does get carried over. But this is funds that would come out pre-tax, and so you have the ability to just use the funds up front. There is a use it or lose it rule that applies. So if you don't use the funds, you would lose it. If you left the company and you used it all, you do not have to pay it back. Or if you left the company and you didn't use it, it stays with the company. So you have to make sure that you're very conservative. But if you can use it to pay for your office visit co-pays, you can use it to pay for prescriptions, you can use it to pay for your glasses, whatever your co-pays are, you can use it to pay for those services. The dependent care, you can contribute. That does not have the use it or lose it rule that applies. So you will not be able to use the funds until the money is contributed from your paycheck. And so if you would not lose those funds. And then the dependent care FSA does have a grace period. So if you have any eligible expenses that are incurred between January 1st, 2018 and March 15th, 2019, the claims can be submitted for reimbursement up till March 1st, 31st, 2019. There's also a parking and a transit benefit, so you can elect $260 a month to help pay for parking or transit if you're commuting. And so this does not have a use it or lose it. It is not subject to the flexible spending account rules where you can cancel it at any time. The flexible spending account would elect. It is mandated by the government, so you cannot just cancel your FSA at any time. The qualifying event rules apply to this, but it doesn't apply to parking or transit. And then so we've also provided a scenario with an example of what it would look like with an FSA versus without the FSA. So you'll see the example here, the weekly earnings is $400. So without the FSA contribution, your taxable wages are based on the $400. And then the eligible out-of-pocket expenses, so let's say this person knew they were going to have some dental work done, and they're going to pay $110. So the net take-home pay is $189.40. But with the FSA and the FSA contribution, that $110, this actually makes the taxable wages $290 instead of $400. And so the taxes are reduced, and then the eligible out-of-pocket expenses are paid before taxes. So you'll see that the net take-home pay is higher and the weekly savings compared to not having the FSA. So again, if you're going to have dental work or you're going to be using your medical plan throughout the year, this is a really great option, because if you need to use the whole funds in February, you can use all of it in February. Okay. So real importantly, all employees must elect coverage in PlanSource or they will be dropped from coverage for 2018 and will not be able to enroll again until open enrollment next year, effective January 1st, 2019, unless you experience a qualifying event. So again, you must go in and enroll to elect your coverage. If you do not go in and elect coverage, you are not going to be insured, and you will have to wait until open enrollment 1 year from now. So benefit questions throughout the year. So services, we are your health insurance broker. We are here to support you throughout the year if you ever have questions about your benefits, even for simple things as you've lost your ID card or you never received your ID card, or if you have bills from your providers and your insurance didn't pay and you don't know why. Those are the types of things that we can help with. Rather than going to HR with your privacy protected information, you can always come to us directly. We have our 800 number as well as our email address, which is mybenefits@nsur.com. That goes to our service. I also have an Christina Calvetti and then Lisa Fan, our customer service associate. So any one of them can account manager can assist you throughout the year, benefit questions. So rather than you calling those 800 numbers, ideally you'll want to just give us a call. So we are here to support you. And that concludes our session. And I am going to open